So right now you are going to watch the most important video I've ever put on YouTube. The reason why is this video is going to be more beneficial for you at some point in your life. It may be right now, it may be in 10 years, 20 years. I do not know that answer, but I do know it is the most important video. And the reason why is anytime you find something that's a time machine in a sense and can take you back, can pull you back and give you more time in a healthy way, that's what you're about to see. Wait until the very end of this video. I'll be closing it out with some more information, but this is step one on PRP.
All right, good morning.
Little ultrasound this morning. So today is the day. We talked about this a while ago, but I am doing preventative. Let's I guess the terminology would be manage the decline. Slow it down, do the best you possibly can at this point. So we're just looking at the knee.
So we have an ultrasound
As
first.
much as we, talked about the first time, what we're really dealing with is obviously wear and tear, a lot of mileage on these knees.
Right.
So when we say preventative, obviously we want to slow down this process of degeneration, but clearly the joint can use help because there are signs of wear and tear, which is not unexpected.
40 years of lifting?
Yes,
Eh,
there you
not
go.
bad.
It's not
Not
that
bad.
long. It's not that long.
Right. We want to go another 40, right?
Exactly.
That's why we're here.
All right, so we're doing the ultrasound first, right? And then
Yeah, he wants to.
what's the next step? What's
Just,
happening today?
Well, right now,
Taking a look right now where things are, just making sure there's no fluid in the joint. If there's too much signs of inflammation, then sometimes we have to drain that fluid out. But Mike's doing pretty good.
Oh, nice to
in terms
know.
of, right.
I did
Still
not know
some
that.
inflammation along the ligaments by the side of the knee.
That's from sitting on the plane.
So could that
A
have
long
been?
flight.
I got a great massage yesterday and some scraping and a good leg workout. So
Right.
I always feel a little bit
Yeah.
swollen after that kind of stuff.
So you know what you're undergoing today, right? The title of the procedure.
Tell me the title.
Okay.
Let me.
What you're having is called PRP, or platelet-rich plasma, and platelets are kind of cells in the blood. Our blood is predominantly made up of 3 cells: red cells that carry oxygen, white cells that fight infection, and platelets, which really contain like 10, 12 growth factors. And they really do a lot of work for us. They help stop bleeding, they help heal tissues, stuff like that. So what we're going to do is we're going to draw blood.
Okay.
And this is going to be more than your average blood draw, but then you're more than an average person.
So my
So-
question, or the fans asked, what is the green blood? What is that? Is that the kryptonite that I'm just fighting? Oh, I'm just kidding. I'm just messing with them now.
I can make it look any color you
Any
want.
color? Wow. So I'm
You know.
excited. I've never done something
Right.
to this level.
I mean, and the amazing part of this is all you're getting today is your own cell, the concentrate of those platelets once we remove the red and the white cells out from the blood. And that's where the real gold mine of growth factors is. And our goal is to aid the body's process of regeneration and repair, which is happening 24/7 anyway, right? So what we're doing today in the knees is helping that process of regeneration and repair to take care of some of the damages that might have happened. Just, it's like the tires wearing off, and you just want to make sure you retread them before they give out on you.
I love it. I love it. I have a lot of questions, but I'll wait until the downtime if
Sure.
I can ask you those then. Let's
Like,
draw some blood.
Whoa. Ready?
Ready.
All right.
Time, I'm also going to
Yep.
hit those knees with some LED light therapy. We have a very high-powered system. What does is that gets the mitochondria in the cells a little bit more excited. So when these growth factors go in, they're ready to work on your
prepping it
knees.
as well.
Yeah. Yes.
And I got a ton of questions here too, so we'll do that during
Sure,
that process.
let's get the blood drawn and then we'll have time.
Okay.
Just a minute here.
And if I can add some more years onto training, this is what I'm doing. I'm putting the money into this instead of a car or a fancy, car or vacation or something. This is where it's going. Dr. Goswami, this is a name that you're going to need to remember. I'm going to give you all that information here. talk to his staff. This is something you should probably look into if you guys are walking around with some injuries. Again, now I did this before anything too bad has ever happened to me. And I love it. I absolutely love it. I know this is early on. This is only 1 week after the video you just saw. But I'm telling you right now, if it continues to do it how it feels, we found something there, buddy. Titans around the world. All right. I'll see you next week with video number 2.